Hello guys, in this video let's make anti-cancer drug easy. Seeing the request on Telegram group, so many of you facing problem on how to remember the anti-cancer drug. Let's get started and we'll first of all see the mnemonics, then also at the end we'll integrate with the first aid so that we don't miss any of the important one. Let's get started with the anti-cancer drug. So first of all, when you think of the anti-cancer drug, so these are the drugs that will what is cancer. Cancer is rapidly proliferating cells, so we need to act on that rapidly proliferating cells and we need to decrease the growth. So when you give this when you give any drug, so it will not only affect the cancer cells but also the normal cells. So this is important. So what are the side effects that anti-cancer drugs can give you? It can cause bone marrow suppression. Okay, so see, this almost all the drug causes bone marrow suppression except you have vincristine. Okay, see, vincristine does not cause, then bleomycin does not cause bone marrow suppression, asparaginase does not cause bone marrow suppression. Okay, now coming on to the other side effect, like it can cause mucosal ulcer. Okay, it can cause alopecia, that is loss of hair. It can be teratogenic, that on the baby fetus, that it can cause damage effect, and it can cause azoospermia, decreased sperm count, or it can cause anovulation. So problem related to fertility. So these are the common side effect of anti-cancer drug. Then now coming on to the cell cycle. When we talk about the cell cycle, so we have G1 phase, we have S phase, we have G2 phase, we have M phase. If you see the cell cycle, see G1 followed by S. See, this is the G1 phase, S phase, G2 phase, M phase. If these drugs acts on the cell cycle, they are known as cell cycle specific drug. Otherwise, they are known as the cell cycle non-specific drug. Now coming on to some characteristic toxicity of this drug. So remember this man, that is a chemo man. Okay, so when you look at this one, so here you will have cerebellum. So when you have cerebellum toxicity, means cerebellum ataxia, that is due to cytarabine. Okay, cytarabine. So cerebellum cytarabine, you can say CC. So you can remember like this. Now coming on to ototoxic drug, that is ototoxic, you have this platin wala group, that is carboplatin and cisplatin, they are ototoxic group of drug. Then coming on to then this ototoxic, also this cyclophosphamide is also the ototoxic. Now coming on to the drugs that causes peripheral neuropathy. So for peripheral neuropathy, we have the drug that is vincristine. Then pulmonary fibrosis, that is bleomycin, that it blows out your lungs, and busulfan. Then coming on to cardiotoxicity. So cardiotoxicity, we have these drugs like doxorubicin, daunorubicin. So remember dil wala drug, dil means heart, that is cardiac. So this can cause cardiomyopathy. Then you have cisplatin and carboplatin. So these drugs are nephrotoxic. And what is the antidote for nephrotoxic? That is amifostine. So this is important MCQ. This is an antidote. Then cyclophosphamide. So this cyclophosphamide causes hemorrhagic cystitis and the antidote is mesna. This is again important. See, if you have non-specific toxicity, this we have already discussed. It may be either bone marrow suppression, nausea, vomiting, alopecia. These are the general side effects if we talk about. Then we have other side effect like see pulmonary fibrosis. When we talk about, so these are the drugs that causes pulmonary fibrosis. So think of all the letters that has like bus type. So if the name come busulfan, that is bus is coming. Then carmustine, car is coming. Then cyclophosphamide, cycle is coming. Methotrexate, looks like truck is coming in the name. Amiodarone, that is drone is coming in the name. Then bleomycin, it blows out the lung. So these are the drugs that causes pulmonary fibrosis. So this is important from the MCQ point of view, the drugs causing pulmonary fibrosis. This is important. Then here when you talk about this man, so there may be hand-foot syndrome. So this hand-foot syndrome is caused by mainly two drugs. That is you have capecitabine and you have 5-fluorouracil. So this capecitabine is the prodrug of 5-fluorouracil. So this two drug causes hand-foot syndrome. Then we also talked about here the peripheral neuropathy. So peripheral neuropathy, it is caused by vincristine and the taxane group of drug, like paclitaxel and docetaxel group of drug. So this was about this chemo man that we need to remember. Now coming on to the important part, that is cell cycle specific and non-specific drug. When we talk about the cell cycle specific drug, so basically this cell cycle specific when the cells are proliferating. So this will act either in S phase, G2 phase, M phase or G1 phase. So these are the phases of cell cycle, so the drugs will act accordingly. So first and cell cycle non-specific drug. So we have 4 categories: alkylating agent, then we have platinum compound, we have anthracycline, and we have anti-tumor antibiotics. So which are cell cycle non-specific drug. So coming on to the first category, see, when we talk about the example alkylating, we have mephalin, we have cyclophosphamide and nitrosourea. Then platinum compound, see all the name platin comes, cisplatin, carbiplatin, oxaliplatin, platin wale things. Then anthracycline, if you say, so doxorubicin rub, danorubicin rub, epirubicin rub. Then anti-tumor antibiotic, you have 2 things, that is dactinomycin and mitomycin. See, these are the anti-tumor antibiotics wale compound. So this were the 4. Now coming on to the alkylating agents per se. So first of all we have nitrogen mustard, where we have drugs like cyclophosphamide, ifophosphamide, and also one more drug, that is melphalan. So now what are the things that we need to know, and how does this alkylating agent work? So this alkylating agent, they alkylate nucleophilic groups on the DNA base, that is N7 of the guanine. So this may be asked as a MCQ. That will lead to cross-linking abnormal base pairing. So this is the mechanism of the action of alkylating agent. So what are the side effects? The normal side effects like bone marrow suppression, mucosal ulcers, alopecia, diarrhea, and other things, and sterility. Then when we talk about this cyclophosphamide, so this cyclophosphamide, when it's get metabolized, it's get converted into acrolein, which causes hemorrhagic cystitis, and the treatment is mesna. And what is the use of cyclophosphamide, ifophosphamide? They are the drug of choice in Wegener's granulomatosis. So this is important drug of choice. What are the other side effect of cyclophosphamide if we talk about? That is SIADS, syndrome of inappropriate diuretic hormone. And this can also cause, if you remember, cycle was there, means pulmonary fibrosis. Name of some cycle carbus, that is, so it will cause pulmonary fibrosis. We have already seen the mnemonic for drugs causing the pulmonary fibrosis. Then coming on to the other drugs, that is mephalin. So how will you remember? M for multiple myeloma. So this drug is used in the treatment of multiple myeloma. Then we have next drug, that is meclorethamine, that is used for Hodgkin's lymphoma. Now coming on to the second group, that is alkylating agent, that is nitrosourea. So here we have all this must wala thing, carmustine, lomustine. So this drug, remember one thing, these drugs are lipid soluble drug, means they can cross blood brain barrier and go, hence they are used for brain tumor. This is important, and this will cause delayed neutropenia. This side effect is also important. Then we have 2 other drugs, that is streptozotocin and dacarbazine. So this dacarbazine, this inhibits the RNA and the protein synthesis, and this streptozotocin, they destroy the beta cells of the pancreas, hence used for islet cells tumor like insulinoma. So this streptozotocin is used for insulinoma, and this dacarbazine is used for Hodgkin's lymphoma, more commonly malignant melanoma. Now coming on to some other drug, that is like busulfan. So first bus is coming, means side effect will be pulmonary fibrosis. Remember, so side effect is pulmonary fibrosis, that is lung fibrosis. This causes, so what happens in busulfan? Normally what happens when hydroxylation does not takes place in the skin and the lungs. So in the skin this causes flagellate dermatitis, and in lungs it causes pulmonary fibrosis. So this is important, and this can also cause hyperuricemia. Then you have other drug like procarbazine. So this drug, this causes disulfiram like reaction, and this is important. This is the most leukemogenic drug. This is important to remember here. And we have one more drug, that is chlorambucil. So this drug chlorambucil, we have already discussed that this spares the myelocyte, means there won't be any bone marrow suppression. This we have already discussed, and this is used for CLL, that is chronic lymphocytic leukemia. So and we have one more drug when we read the first aid, that is tenozolomide. So remember, tenozolomide, OL, means this is a oral drug but with 100% bioavailability. And this also crosses the blood-brain barrier, means it's used for brain tumor, but the most severe brain tumor, which was earlier known as glioblastoma multiforme, grade 4 tumor. And what do we see in the grade 4? If you recall your path knowledge, we see the serpentine necrosis and the glomeruloid body. If you can recall from your path in grade 4 tumor, these are the two findings that we see. And this cyclophosphamide has been already discussed. So other things that we need to know here. Then coming on to the next group, that is platinum compound. So all things that will platin name will come: cisplatin, carboplatin, oxaliplatin. So remembering the cisplatin wala drug. So this cisplatin drug, this causes the maximum emesis, that is vomiting, nausea, vomiting. So if it occurs immediately, so we will use 5-HT3 antagonist for treatment like ondansetron. If it is a late occurring, then we will use substance P antagonist, that is aprepitant. So this is important. This can be asked as your MCQ. This drug does not only cause vomiting, but this is also nephrotoxic, and this is also ototoxic. But there is no bone marrow suppression. So this is important here. Then what we can do? To prevent this nephrotoxicity, we can perform chloride diuresis. Okay, chloride diuresis can prevent nephrotoxicity. Then we have other drugs like we have carboplatin. This causes bone marrow toxicity, and oxaliplatin, and this causes peripheral neuropathy. Not much to remember, but this oxaliplatin is important in the colorectal cancer. We have two regimen: FOLFOX regimen and FOL-free regimen. So FOLFOX, if you see, FOL, that is folinic acid, F is 5-fluorouracil, and OX means oxaliplatin, which is used for colorectal cancer. Then coming on to the next one. Okay, and this drug decreases all the electrolyte in serum. This is important. Then coming on to the anthracycline group of compound. So this anthracycline group of compound inhibit the topoisomerase 2, and this inhibit the RNA synthesis, anthracycline group. So what are the side effects? We have drugs like doxorubicin, and we have drugs like danorubicin. These are cell cycle non-specific drug. So this cause dil ka toxicity, dil heart, that is cardiotoxicity, and this is due to the semiquinone free radical. It may cause red colored urine, anthracycline. Okay, so doxorubicin, remember rubicin, ruby, that is red ruby. That is, it can cause red colored urine. So this may be asked as your MCQ. When you remember red colored urine, that is, it can also cause radiation recall syndrome. And what is the treatment? We have drug that is dexrazoxane, which may be asked as your question. And these are used in acute leukemia. So this is important that we need. Now coming on to the other one, that is anti-tumor antibiotic. So anti-tumor antibiotic, they prevent the cell division. So this we have two drugs like dactinomycin and mitomycin. They are used for pediatric solid tumors like Wilms tumor and rhabdomyosarcoma. And this mitomycin, they are used for superficial bladder carcinoma and for laryngeal stenosis. Not very important, but maybe asked. Now coming on to the specific wala thing, that is cell cycle specific drug. So either acting on the G1S phase, S phase, G2 phase, M phase. So G1S, it's etoposide drug. Okay, that acts on G1S phase. S phase, we have two categories, that is the anti-metabolite wala category and hydroxyurea. The drug that you remember, it increases HbF in sickle cell anemia. This I think this use everyone remembers by now. Then we have methotrexate, we have 6-mercaptopurine, we have 5-fluorouracil, and we have capecitabine. So remember like this, anti-metabolite 56 cm. Okay, 56 cm. So this is about. Then G2. So G2 we have irinotecan, topotecan, etoposide, and bleomycin. These are the 4 drugs that comes under topoisomerase inhibitor G2 drugs. Then we have M phase. So remember TV. We have taxane and vincalcolide. Vincalcolide we have mainly 2 drugs, vincristin and vinblastine. Taxane we have all this taxol drugs, paclitaxel, docetaxel, and other drugs like stramostin, which is not so important to remember. Now coming on to drugs one by one. So first of all we are coming with this purine analog swallow drug. So this 6 mercaptopurine, and so this 6 mercaptopurine, they are the purine antimetabolites. They are activated by enzyme that is hypoxanthine guanine phosphosyl ribosyl transferase. So this 6 mercaptopurine is metabolized by xanthine oxidase. Now if you can recall your knowledge of gout, so we have drugs that inhibit the xanthine oxidase. What are the drugs? That is allopurinol, and also one more drug, that is febuxostat. If you see the name febuxostat, Exocum, that is xanthine oxidase inhibitor. So when this inhibits this enzyme, this drug won't be metabolized. So toxicity will cause. So you need to reduce the dose to 1/4 when you give simultaneously with allopurinol. This is important. Now we have one drug, that is cladribine, that is used for hairy cell leukemia. This is also important, that is TRAP positive hairy cell leukemia, tartrate resistant acid phosphatase positive. This is important from your path point of view. Then you have one more drug, that is fludarabine. So when you have flu, you call the doctor. Okay, so call for flu. So that is fludarabine. Then we have pyrimidine analog. So when you talk about the pyrimidine analog, so we have drugs like cytarabine, then we have drugs like 5-fluorouracil, capecitabine. These are the drugs for your pyrimidine analog. So this cytarabine, you remember we talked about 2 side effects, that is cerebellar toxicity, and we have conjunctivitis. This is important. Then the important category, that is 5-fluorouracil. So this 5-fluorouracil, it inhibits thymidylate synthase. So as a result, this prevents the synthesis. So this is used for basal cell carcinoma and mycosis fungoides. Remember, this is metabolized by the respiratory pathway, hence eliminated by the lungs. And side effect we have already talked about, 5-fluorouracil and capecitabine. Both of them causes hand-foot syndrome, and the side effect is most common adverse reaction is the diarrhea. This is important. Then we have capecitabine, already discussed. Then we have gemcitabine. So this gemcitabine, this is used for pancreatic carcinoma. This is important. Now coming on to this next category, that is when we come to the next category, that is your folic acid analog, that is methotrexate thing, and one more drug, that is pemetrexate. So what is the use of this folic acid and this pemetrexate and methotrexate? So this pemetrexate, remember its 2 use. Remember it is used for mesothelioma, and P, if you remember, so from the P, remember its use of peripheral T cell lymphoma. So these are the 2 uses that we need to remember for this category of drug. Now coming on to this methotrexate. So this methotrexate, how does it act? It inhibits the enzyme dihydrofolate reductase. As a result, when it inhibits, there is inhibition of formation. So what are the antagonists? We have folinic acid or leucovorin, that are the antagonists. And what are the side effects? It can cause mucosal ulcer, it can cause stomatitis, it can be hepatotoxic, and pulmonary fibrosis, since the name methotrexate trucks, that is, it will cause pulmonary fibrosis. Now what are the uses for this drug? Remember the mnemonic: cancer, C for choriocarcinoma, A for abortion, N for non-Hodgkin's lymphoma, C for Crohn's disease, that is IBDs, inflammatory bowel disease, E for ectopic, and RA for rheumatoid arthritis. So see, when we talked about the S phase, we had antimetabolites. See, we have already discussed methotrexate, dihydrofolate acid reductase inhibitor. Antidote is leucovorin, and we need to remember the cancer mnemonic. See, 6 mercaptopurine and 5-fluorouracil. Already this 5-fluorouracil and capecitabine, prodrug of each other. This capecitabine, both of them causes this hand-foot syndrome. So this were the important things that we need to know. Now this hydroxyurea, what does this hydroxyurea does? This hydroxyurea increases the HbF. This is used for sickle cell anemia, this is used for polycythemia, and this is used for essential thrombocytosis. This is important that we need to know about these drugs. Now coming on to the drugs that acts on S phase already done. Now coming on to this G2 wala phase. Okay, so we have bleomycin. So that is bi. Remember, this is on 2 phase. So what does it do? So bleomycin breaks the DNA strand, and this is again used for various cancer. Bleomycin, it causes, there is no hydroxylation present in the skin and the lungs. In lungs this causes pulmonary fibrosis, and in skin it causes flagellate dermatitis. This is a previous year question. And what is the earliest marker? That is decrease in diffuser lung capacity. This is important. Then coming on to the next category in G2 phase, that is you come to the topoisomerase inhibitor. So we have E-toposide and we have irinotecan. So this irinotecan, okay, so this is topoisomerase 1 inhibitor, but this E-toposide, that is topoisomerase 2 inhibitor, and this is used for testicular carcinoma, E-toposide, and for small cell cancer also known as oat cell cancer. Then irinotecan already we have discussed, fall free regimen Folfox for colorectal oxaliplatin was used, and here fall free, that is IRI, irinotecan. This is again important. Then coming on to M-phase specific, we already talked about 2 drugs, that is MTV, taxane and vincalcolide. We have vinblastine and vincristin. Remember, one of them causes myelosuppression. This is the most confusing. Remember, vinblastine, this causes blast to the bone marrow, hence this will cause bone marrow suppression. So when this cause bone marrow, so other will spare the bone marrow. This vincristin, this is a Christ, good things, God spare good thing. So there is a bone marrow sparing. And we have 2 side effects, that is peripheral neuropathy and SIDH, common in both of them. So what does this vincalcolide do? So they inhibit the microtubular polymerization. And what does this taxane do? They prevent the dissociation of the already formed microtubule. This is important. And this can cause bone marrow suppression. Again, we can have neurotoxicity. So this was about your M-phase specific drug. Now coming on to the drugs acting on this G1 phase. So G1 phase, when we talk about the drug acting, we have one drug, that is L-asparaginase. So what does, some of this tumor cell require this asparagine, okay, this protein. So when you don't have give, it's not possible. So this is used in leukemias and lymphoma. How will you remember this asparaginase? PAR, that is pancreatitis, and this can also cause CVT, cortical bone thrombosis, and this is again a bone marrow sparing agent. This already has been discussed. So can we recall, guys, what were the bone marrow sparing agent if we try to recall? So bone marrow sparing agent, one of them all except, okay, we have vincristin, Christ, that is God spares good thing. Then you have bleomycin. This is again a bone marrow, though it causes pulmonary fibrosis and flagellate dermatitis. Okay, then we have L-asparaginase, and we have one more drug, that is chlorambucil. So these are the drugs that are bone marrow sparing agent that we need to know here. See, this already has been discussed. Vincristin, vinblastine, both of them causes SIADS. See, already done. Oxaliplatin, cisplatin, they causes ototoxic, they were nephrotoxic, and they were emetogenic. Then bleomycin and busulfan, both of these causes BB, 2 lungs, okay, pulmonary fibrosis. Doxorubicin, danorubicin, so cardiotoxic, and you have rube, that is red in color. So this can cause redness wala thing, okay. Then cisplatin, already discussed, it's nephrogenic. Then cyclophosphamide and ifosfamide, this causes hemorrhagic cystitis. Then you have vincristin and vinblastine wala thing, okay. So this vincristin, they causes peripheral neuropathy. Then hepatotoxic, we have drugs like 6-mercaptopurine, 6-thioguanine, and also drugs like methotrexate. Then we have drugs like tamoxifen, that is a selective estrogen receptor modulator. They can cause cataract and retinopathy. Then drugs causing pulmonary fibrosis, we can already see cycle, car, bus, methotruck, drone, and bleomycin. So this bleomycin, remember, it blows out the lung. So this was about the drugs that it causes pulmonary fibrosis. Now moving to the next step further, after we are done with this, okay, we are done with this, then we have some other category, that is thalidomide. So what are the things that we need to remember about this thalidomide? So this thalidomide is used for type 2 lepra reaction and multiple myeloma. This is very important thing. And side effect is constipation, not so important. And we have one more drug in this category, that is lenalidomide, which is more potent and non-teratogenic. This is important. Now coming on to this drug, we have two drugs for hairy cell leukemia. One is the cledrabine and one is the pentostatin that we need to know. This octreotide, so this octreotide is used for insulinoma. It is also used for secretory diarrhea. Then hydroxyurea, already 3 use has been discussed, guys. That is sickle cell anemia, polycythemia vera, and essential thrombocytosis. Then we have ATRA and AH2O, that is arsenic ka compound and all trans retinoic acid. If you recall your classification AML wala, so what we have, AML M3, okay, that is translocation 1517. That is PML RARA translocation. What is RARA? RARA, that is retinoic acid receptor. Okay. So when you have translocation, we have treatment all trans retinoic acid and arsenic. Then you have sipuleucel, that is used for prostate carcinoma. Then we have a specific therapy for chemotherapy regimen. See, Hodgkin's, remember the AVVD regimen. A for adriamycin. Then B for bleomycin. V for vincristine, already done. And D for dicarbazine, already done. Then non-Hodgkin's, that is a CHOPA regimen. C for cyclophosphamide. Side effect, hemorrhagic cystitis, MESNA, and pulmonary fibrosis. H for you have hydroxydorubicin. O for oncovin. Vincristine is only known as oncovin. This is important to know. Then P means prednisolone, which is a steroid. And R means rituximab, that is anti-CD20. Then ALL. Then we have CVAD, cyclophosphamide. V for again vincristine, A for again adriamycin, and D for dexamethasone here instead of prednisolone. Colorectal, already discussed, Folfox regimen and the Folfree regimen. OX is for oxaliplatin and IR is for irinotecan. CLL, we have 3 drugs, fludarabine, you remember, call for flu. Then we have cyclophosphamide, so he will come on cycle, and rituximab. Then testis cancer, we have again BEP regimen, bleomycin, etoposide. So these are Hodgkin's is important, colorectal is important. These are the two things that is important to remember. Now coming on to other drug that may be asked. So here we are not only doing this, but we will do all the other category drug nearby which can be asked. So we have proteasome inhibitor. So this proteasome inhibitor, they are used for multiple myeloma and they end with Zomib. This proteasome inhibitor. Then you have histone deacetylase inhibitor. So this histone deacetylase, they are used for cutaneous T cell lymphoma. Then mTOR inhibitor. So mTOR inhibitor, remember this is sirolimus, sirolimus and everolimus. This is again important. Then what is important, guys, here? These things are not so important. Then tyrosine kinase. Do you remember imatinib? This is the drug of choice for GIST. That is CD117 antagonist. This is important. See, whatever we have talked about for CML. CML, we have 4 drugs. That is bind. Okay, so what is important here? Imatinib and dasatinib is important. CML, what is the translocation? Translocation chromosome 922, BCR ABL gene fusion. Then non-small cell carcinoma lung. So it's not so important. GIST. What are the drug for GIST? One is the imatinib, that is the drug of choice, anti-CD117, and you can also give sunitinib. Then RCC, the mnemonic is passed, not so important. Then for malignant melanoma, remember the drug, you have a drug that is dabrafenib. HCC, that is sorafenib. Medullary carcinoma, not so important. Rheumatoid, this all are not so important to remember. Then see, coming on to this monoclonal antibody wala concept. When you come to the monoclonal antibody, see, first of all, what all the things are that you need to remember. This omalizumab is very important. It is a IgE antagonist, means bronchial asthma it will treat it. Then what thing? Rituximab, this is the anti-CD20 wala drug. So anywhere where the B cell proliferation is high, you can give it. Then you have cetuximab, that is the epidermal growth factor receptor ka antagonist. So this may be used in cancers. Then this is very important, that is trastuzumab and pertuzumab. This is a HER2 neo, okay, that is, remember the mnemonic trust her, okay. So these drugs are used in breast cancer. When you remember in a TNF alpha ka antagonist, remember the mnemonic I cage, okay. I is for infliximab, C for certolizumab, A for adalimumab, C for golimumab, and E for etanercept. So these drugs are used in rheumatoid arthritis treatment. Then you have two drugs which is IL-6. So 6, how will you remember? 6, that is saralizumab, that is 6 only it comes. Then we have other drugs like secunimab, that is used for interleukin 17, okay. Then remember secunizumab, that is 17. Then we have two drugs, that is ustekinumab. This drug is interleukin 12-23 antagonist. This is again an important question. Then denosumab, that is osteoporosis, that is against the rank ligand. This is very important. Then we have eculizumab. So this drug is used for PNS, paroxysmal nocturnal hemoglobinuria, in which where you have a problem with CD55 and CD59. What is CD55, guys? That is DAF, decay accelerating factor. And what is CD59? That is MIRL, membrane inhibitor of reactive lysis. How will you remember it? DA, that is 4 + 1 5, that is CD55. So don't get confused which is DAF, which is MIR. Now coming on to pavalizumab. This is against the virus, which against the respiratory syncytial virus. This is again an important question. Then against the malignant melanoma, we have against CTLA4, that is ipilimumab. This is again important, and other things are not so important that you need to remember from this perspective. Now coming on to the other uses of rituximab, that was anti-CD20. So remember the mnemonic reliance. RE, that is rheumatoid arthritis. L means lupus, that is systemic lupus erythematosus. I means immune thrombocytopenic purpura. A means autoimmune hemolytic anemia. N means non-Hodgkin's lymphoma, and C means CLL. This is important. See, this we have already seen. This TNF alpha, the mnemonic is I cage. And you have topical treatment of what? What do we give? We can give imiquinod, which is an immunomodulator, or podophylotoxin, which inhibit the polymerization of tubulin. See, this two already discussed. Cladribine for hairy cell leukemia. Also one more drug, that is pentostatin. And we have fludarabine, that is used for CLL. See. So whatever side effect we have discussed, guys, see, this is the methotrexate mnemonic, that is cancer, already discussed. Crohn's disease, abortion, non-Hodgkin's lymphoma, choriocarcinoma, ectopic, and rheumatoid arthritis. Now see, some important side effect. Methotrexate, what are the side effects? It can be hepatotoxic, it can cause mucositis, it can cause pulmonary fibrosis. 5-fluorouracil and capecitabine. The most important side effect there is hand-foot syndrome. You can see. Okay, then cytarabine, this causes cerebellar toxicity, ataxia, and conjunctivitis. Fludarabine, that is you have arthralgia as the side effect. And gemcitabine, the drug for prostate wala thing, okay, that is used for diarrhea. Now coming on to some other toxicity. Bleomycin, pulmonary fibrosis, but this is marrow sparing. Anthracycline, doxorubicin, and daunorubicin, dil wala thing, that is cardiotoxicity. Then taxane group, paclitaxel, doxycycline, or taxane group, all will cause this peripheral neuropathy wala thing. Then irinotecan, this irinotecan causes diarrhea. Now vincristine, vinclastine, the vinca alkaloid wala thing. So vincrastine spares the marrow because God is there, Christ. But vinblastine will blast the bone marrow, and this also causes SIADH. This is again important that we need to know. So these are some of the common side effects of hormonal drug. So this is not so important. See, that is one is SCRM, guys. So here you may have menopausal symptoms and other thing that may be asked to you guys. Okay. Now coming on to see other drugs that is used to prevent the toxicity. Okay. See, allopurinol. What does allopurinol know, guys? Try to revise it. Inhibits the enzyme xanthine oxidase. Hence, this prevents hyperuricemia. Then rasburicase. Again, this is again used for this only gout only, but this is a recombinant urate oxidase. Again, the same use. Then mesna where we use to prevent the hemorrhagic cystitis due to ifophosphamide and cyclophosphamide. Then leucovorin. So this leucovorin, so basically they are used for methotrexate ka toxicity, that is folinic acid or your leucovorin. Then you have amifostin. We have already discussed this, guys. This is used basically in order to prevent the nephrotoxicity due to cisplatin. Then darajoxon. So this was used for dil wala thing, where you have cardiotoxicity due to doxorubicin and prevent the cardiotoxicity. Then you have other drugs that is not so important, and this bisphosphonate. When you have hypercalcemia of malignancy, we have drugs like pamidronate and zoledronic acid. Now coming on to this granulocyte wala thing. Okay, so we have filgrastim, that is granulocyte colony stimulating factor. Then see, when you see sargramostim, that is granulocyte monocyte colony stimulating factor. Then we have opre lekin. It looks like 11 if you read it, guys. That is interleukin 11 ke against it will act. Then see, ondansetron, palisetron, all are used for nausea and vomiting. That is 5-HT3. Aprepitant, already NK1 antagonist, substance P wala thing, used for delayed vomiting. This all, guys, we have already discussed. Now coming on to the things that we have not discussed. Okay, coming on to the things which are there in your first aid. See, let's revise the first way. Think about the bleomycin, guys. It blows out the lung mate. It will cause pulmonary fibrosis and flagellate dermatitis, and it breaks the DNA strand. Now dactinomycin is anti-tumor wala antibiotic wala thing. This causes myelosuppression. Then anthracycline. Remember, we have doxorubicin and daunorubicin. This can cause dil wala thing, that is dilated cardiomyopathy. And see, remember, see, all these come together, and treatment with toxicity with dexrazoxone. Then coming on to the antimetabolites group. So we have first thiopurine, that is azathioprine and 6-mercaptopurine. So say this 6-mercaptopurine is inactivated by xanthine oxidase. So you need to decrease the dose to 1/4 to decrease the toxicity. Then two drugs that goes hand in hand, that is cladribine and pentostatin, both used for hairy cell leukemia. Then you have cytarabine, again used in lymphoma, and this can cause cerebellar ataxia. Then 5-fluorouracil. So this 5-fluorouracil, guys, this again is used for it's used in this one, colorectal cancer, where we have FOLFOX and FOL-free regimen, and this causes this hand and foot syndrome. This is also known as palmar plantar erythrodysesthesia. This may be your future MCQ. They may ask you which one of the following drugs causes you palmoplantar. So this may be a future MCQ. This hand and foot syndrome is also known as palmoplantar erythrodysesthesia. Then hydroxyurea. So we had 3 U's, that is polycythemia vera, sickle cell disease, and essential thrombocytosis. Then methotrexate, it inhibits dihydrofolate acid reductase. So this, the mnemonic for this was cancer, and this causes myelosuppression. This may also cause megaloblastic due to folate deficiency. This is hepatotoxic, and this causes pulmonary fibrosis. Then alkylating agent. So all this alkylating agent are cell cycle non-specific, already done, guys. We have like platinum wallet drugs, we have nitrosourea wallet drugs, say busulfan. They breaks the cross-linked DNA. Effect, it causes myelosuppression and pulmonary fibrosis, again done. Then nitrogen compound. So nitrogen mustard, we have cyclophosphamide, ifophosphamide. See the side effect: myelosuppression, SIADH, again prevention with MESNA, already done. See. Then nitrosourea, they cross the blood-brain barrier, means it will use for the tumors wala thing. Then you have procarbazine. This causes disulfiram-like reaction, already done. Temozolomide, this crosses the blood-brain barrier. This is used for high-grade tumor where you see serpentine necrosis. Now glioblastoma multiforme is no more used, it's just the glioblastoma. Now platinum compound, oxaliplatin, cisplatin, they cause nephrotoxicity, and the prevention is amifostin. This is again MCQ. Then peripheral neuropathy and ototoxic. Then you have 2 drugs, that is taxanes and vincalcolite. MTV wala thing, means amphiphage specific wala drug, MTV. So taxane. So what does taxane do? When you pay tax, you become stabilized, that no one can harm you. That is stabilize the polymerized microtubule. And this vincalcolite, they prevent the stabilization. So this is important. And see, this vinblastine blasts the bone marrow, while Christ helps to spare bone marrow. Christ may no bone marrow involvement. This is important, that may be asked from you. Then topoisomerase inhibitor. We have topoisomerase 1 inhibitor and 2 inhibitor. One is irinotecan and topotecan. So remember, like TCON 1 and 2 is etoposide. Okay, this is 2. Again, this causes myelosuppression. Again, the same thing. Then we have tamoxifen, where we have, which is a selective estrogen receptor, SCRM, and the effect is adverse effect is hot flushes and increased risk of DVT and pulmonary embolism. Then coming on to some other drug, that is, see, we have VEGF against antagonist, guys. We have two drugs. One is bevacizumab and one is ranimumab. These two are important drugs. That is bevafarani, VEGF. Then cetuximab, this is against EGFR, already done. Rituximab against CD20, done. Trastuzumab, that is against HER2 new receptor. Then you have other drugs like PD1, this already done. Ipilimumab, that is against CTLA4. Now coming on to some other drugs, imatinib against the c-KIT, already done. See, then we have other drugs that you need to remember, guys, here. That is, see the toxicity wala thing. Remember now, amifostane, that is used for nephrotoxicity. Dexrazoxane, that is dil wala, that is cardiotoxicity. Leucovorin, folinic acid, मतलब folic acid का antagonist वाला thing, that is myelotraxate का toxicity. Mesna means hemorrhagic cystitis, that is due to cyclophosphamide/hypophosphamide. Then rasburicase, it is a recombinant enzyme that converts uric acid to allantoin, means tumor lysis syndrome. Ondansetron, granisetron, 5-HT3 का antagonist है, means prevent the nausea and vomiting. See, okay. Then when you have delayed vomiting after 24 hours, you have a drug that is aprepitant or fosaprepitant, that is NK1 receptor antagonist. Then you have filgrastim and sargramostim, that is a recombinant granulocyte monocyte CSF. Epoetin, that looks like erythropoietin, that is used for anemia. See, then coming on to this immunosuppressant, also we will finish in this chapter only. So we have some important drugs like cyclosporin, tacrolimus, sirolimus, which is also known as rapamycin, and this you have basiliximab. Then cyclosporin, remember, guys, okay, cyclo, you have 2 cycle, that is, it prevents the interleukin 2 ka transcription, and this causes nephrotoxicity. Then tacrolimus, so tacrolimus is a calcineurin inhibitor, this you need to know, and this binds to the FK506. Where do you see something? If you remember, delta F508 gene mutation, guys, that is seen in your cystic fibrosis. This was a question of your this year recent INICT exam. So this is important. Then sirolimus rapamycin, this is a membrane inhibitor of mTOR. So they prevent the response to IL-2. This is important, and this can cause pancytopenia. Now coming on to other drug, azathioprine, again it will go with allopurinol wala metabolism, so this is again important. Mycophenolate mofetil, wala thing, so it will inhibit inoside monophosphate dehydrogenase, guys, okay, and this is associated with invasive CMV infection. So this may be your this year MCQ, that mycophenolate mofetil wala, they will ask something like CMV and they will associate the question. Then glucocorticoid steroid, so the mnemonic is again Cushingoid, C for Cushing syndrome, ulcer, osteoporosis, avascular necrosis, peptic ulcer, the same thing. See, erythropoietin already done. So we have filgrastim, that is granulocyte, and sargramostim, GN both, that is granulocyte and monopocyte. Then thrombopoietin, so you have romiplostim, PLSIM, that is platelet stimulator, remember like this, guys. Interferon, guys, if you say, gamma means granuloma, beta means brain में जाएगा, that is multiple sclerosis, alpha means ABC, that is hepatitis B and C. Then coming on to the other therapeutic medication that we have done, guys. Adalimumab, infliximumab. What was this mnemonic? ICAGE wala mnemonic. That is TNF alpha ke against we can use. And etanercept is also there in case. That is a decoy TNF alpha receptor, but not a monoclonal antibody. Then see then you have secukinumab, that is 17, interleukin 17 ke against for psoriasis. Then ustekinumab, that is against 12-23, psoriasis against psoriatic arthritis. Then denosumab, remember this denosumab make the bone dense by acting on the rank L ligand. Then you have omalizumab. Okay, this omalizumab is against the IgE. Pavlizumab VI against the virus, that is respiratory syncytial virus. Now how do you name this drug, guys? Okay, monoclonal antibody. All the drug that is mab in the name are the monoclonal. So XI, if the name is there, like rituximab. So this is chimeric. This is important. Then ZU, if is there, is the like bevacizumab. This is against VEGF, if you can recall, guys. So this is humanized. UMAB, that is human K against, that is denosumab. If you see U is there against the rank L ligand. Then we have some small molecule inhibitor. If you see imatinib, NIB, that is against the tyrosine kinase inhibitor. Then proteasome inhibitor, see we have already done. This is Jomib, that is bortezomib. Then we have celecoxib. So if you see, that is COX is coming, means COX2 inhibitor ke against it. Like same is the naming. Interleukin, if you see interleukin receptor, this is anakinra. Okay, that is RA receptor antagonist. That is, this is against the interleukin 6 antagonist. So this is important that we need to know. This is the page that is taken from the source book. Then just see guys, cataract tamoxifen already done, pulmonary fibrosis, busulfan, bleomycin already done. Hepatotoxic guys, we have methotrexate, 6 mercaptopurine, 6 thioguanine already done. Nephrotoxic, ototoxic and maximum imetogenic cisplatin already done. Hand foot guys, 2 syndrome, both prodrug wala thing, capecitabine and 5-fluorouracil. Bone marrow suppression, we have pemetrexate, that is used for mesothelioma and peripheral T-cell lymphoma. Sorry guys. And we have now other drug like cardiotoxicity, doxorubicin, denorubicin and cyclophosphamide. Diarrhea, irinotecan already done. Neuropathy already done. Hemorrhagic cystitis already done. Now coming on to the antidote. Hand and foot syndrome, that is neuropathy, matlab pyridoxine will give. Methotrexate, leucovorin done. Again you have anthracycline, so dilwala, that is dexlaroxane, cyclophosphamide, mesna. So when you have tumor lysis, allopurinol or rasburicase. Then we see, this is new thing that we have not read till now. When you have mucositis, mucosa involvement, so we give the palifermin. We have neutropenia, filgrastim. Thrombocytopenia, 11 wala thing, interleukin 11, oprilvecin. Anemia, E-poietin alpha or darbopoietin, erythropoietin name is only come. Then irinotecan induced diarrhea, that is high dose loperamide. Okay. Then so this was about, see this is the anti-cancer regimen guys, which we have run. MOP regimen, AVBD and BIACOP. These are the 3 regimen that we use for Hodgkin's lymphoma. And for non-Hodgkin's we have the RCHOP regimen guys, already done. FOLFOX and fall-free regimen already done. Multiple myeloma, milfelin. Then you have cladribine for hairy cell leukemia. I think guys this helps you revise the topic of your entire chemotherapy, and I think hope this helps makes it easy. Try solving the MCQ guys. I hope you will solve all the MCQ. If you find some new point, add it onto your notes guys, and this makes the topic easy. If you like it, please guys do comment, like, share and subscribe. Happy learning guys.